When you step past the age of 60, you begin to realize something you may never have thought about before. What once felt familiar and certain can change in the blink of an eye. This morning, you were still having coffee with friends, laughing and talking as always. This afternoon, you are standing in front of the mirror and notice your smile is slightly uneven. You tell yourself, it is probably just fatigue, but in reality, your brain may be calling for help. A stroke does not always arrive with a blaring siren. Sometimes it begins with changes so small you can easily overlook them. A sentence that suddenly becomes difficult to speak clearly, an arm that feels heavier than usual, or vision that dims as if a curtain has been drawn across it. And if you ignore these signs, just a few hours later, your world can be completely different. This video is not just a list of symptoms. It is a map to help you recognize when your body is sending urgent signals, so you or someone you love can act in time. Because in the fight against stroke, the person who spots the first sign is the one holding the key between life and death. Stay until the very end, because every piece of information here could be the reason you, or someone you care about, is still here tomorrow. 1. Face drooping. Have you ever looked in the mirror in the morning and noticed your smile isn't quite the same as yesterday? One corner of your mouth droops, the edge of your eye seems to sink, as if your face is too tired to cooperate. If in that moment you think, probably just slept wrong, it'll go away in a few hours. You may have just ignored one of the most urgent warning signs your body can give you, the first sign of a stroke. When a blood vessel in the brain becomes blocked or bursts, the area that controls facial muscles loses its oxygen supply instantly. In just minutes, the delicate nerve fibers that move your smile, your eyes, and every subtle expression begin to shut down. A clot lodged in an artery, or a weakened vessel bursting under pressure, can turn a healthy, symmetrical face into an uneven one in the blink of an eye. And for those over 65, whose blood vessels have endured decades of high blood pressure, fluctuating blood sugar, or unhealthy diets, the risk is higher than ever. You can test yourself right now. Stand in front of a mirror and smile wide. If one corner of your mouth doesn't lift as much as the other, if your cheeks don't rise evenly, or if there's numbness or heaviness on one side, don't hesitate. This is not the time to wait and see for a few hours. It's the time to call 911 immediately. Every minute that passes, nearly 2 million brain cells are lost forever. Picture this. You were chatting with your neighbor this morning just fine, but only hours later, you can't smile evenly, water dribbles out of one side of your mouth, and your words aren't coming out clearly. For many older adults living alone, this sudden change doesn't just threaten health, it strikes at self-confidence and the ability to connect with others. Too often, embarrassment drives people to avoid going out, and that isolation speeds up the decline in overall health. The truth is, this danger isn't only from sudden illness. Harmless-looking habits are silently shortening the time your brain can fight back, leaving high blood pressure untreated, sitting most of the day because, at my age, rest is best, or eating salty, high-fat foods with the thought, a little won't hurt. Day by day, they push your blood vessels closer to the breaking point. The good news is you can start lowering your risk today. Check your blood pressure regularly and keep it below 120/80ths mmHg. Move every day even if it's just a 20-minute walk around the block, and choose vegetables and whole grains over processed foods. Most importantly, remember, if your face suddenly changes, it's an emergency signal. Call for help immediately, and never convince yourself it's just because you slept funny. Sometimes, a few minutes of hesitation is the thin line between a full life and months or years of dependence. 2. Arm weakness. Have you ever tried lifting both arms to shoulder height and felt one of them refuse to cooperate? It's slow, heavy, as if someone tied a sandbag to it. You think, I must have slept on it wrong, it'll go away soon. But sometimes, this isn't normal muscle fatigue, it's your brain sending an emergency signal. When a blood clot blocks the flow of blood to the part of the brain that controls movement, or when a blood vessel bursts and puts pressure on those areas, the signals to your arm can be cut off almost instantly. The arm weakens, loses sensation, or simply won't lift at all. For people over 65, whose blood vessels have spent years enduring high blood pressure, diabetes, or smoking habits, this becomes far more likely. You can test yourself right now. Stand up straight and slowly lift both arms to shoulder height. If one drifts downward, trembles, or can't hold its position, treat it as a red alert. Don't comfort yourself by thinking you just slept funny. When your arm suddenly loses strength, your brain is in distress, and every minute you wait, millions of brain cells are gone forever. Picture this. Earlier this morning, you were watering the garden or making breakfast as usual, but within an hour, your hand can't hold a cup, you can't tie your shoes, and it feels like the weight of your entire body is pressing down on your shoulder. For many older adults, this doesn't just take away independence in daily life, it stirs fear, vulnerability, and uncertainty about what lies ahead. The danger is that many people dismiss this sign, blaming sore muscles, overwork, or the weather. But the truth is, daily habits quietly shorten the brain's ability to fight back smoking, which tightens blood vessels and encourages clot formation, leaving diabetes unmanaged, letting high blood sugar damage vessel walls, or living under constant stress, which pushes blood pressure higher and higher. The good news is, you can protect yourself. Quit smoking, keep your blood sugar under control, and move every day to keep your blood flowing. Even gentle activities like walking or Tai Chi can help. Most importantly, if your arm suddenly weakens or goes numb, call emergency services immediately, even if it returns to normal within minutes. It could be a transient ischemic attack, a serious warning that a major stroke is close behind. Don't let hesitation turn a life-saving signal into a final one. Your arm may be speaking for your brain, and you need to listen right now. 3. Speech difficulty. You open your mouth to say a simple sentence, but the sound comes out warped, stumbling, as if your tongue and lips no longer belong to you. Sometimes you know exactly what you want to say, but the words get stuck somewhere in your brain. Or worse, the person speaking to you suddenly sounds unclear, their meaning slipping through your grasp. If this happens out of nowhere, treat it as your brain sounding a loud alarm. Our ability to speak is one of the most complex functions the brain performs. Areas like Broca's and Wernicke's are the language centers, the places that help you choose words, build sentences, and pronounce them clearly. When the blood supply to these areas is blocked by a clot, or crushed under the pressure of a burst vessel, language can collapse in an instant. Someone speaking clearly one moment can suddenly start slurring, mumbling, or lose the ability to express themselves entirely. For people over 65, this is a warning sign that should never be ignored. You can try it right now. Pick a simple sentence, like, "The sky is blue," and say it out loud, clearly. If the words stretch unnaturally, if syllables drop away, or if it sounds offbeat, that's cause for suspicion. And if it's paired with facial drooping or arm weakness, the chances that it's a stroke grow even higher. Picture this. You're a retired teacher, reading a story to your grandchild just like any other day, when suddenly the words on the page become hard to summon, your voice slips, and the story stalls mid-sentence. Just minutes earlier you were fully yourself. Minutes later, the world feels smothered in a fog of language. For many, losing the ability to speak isn't just about losing words, it's about losing a piece of identity and the connection to the people you love. The danger is that many people think it's just fatigue, a bit of alcohol, or stress, and they miss the golden window to save their brain. A diet high in saturated fats can narrow arteries, heavy drinking can spike blood pressure, and sleep apnea can quietly rob the brain of oxygen night after night, all of it slowly eroding your defenses. The good news is you can lower your risk. Keep cholesterol in a safe range, limit alcohol, and if you suspect a sleep disorder, get tested and treated. But above all, if you or someone else suddenly starts slurring words, speaking incoherently, or can't understand what's being said, call emergency services immediately and note the time it began. Every second counts. Don't let the words you meant to say become the words you'll never speak again. Your brain is sending you an urgent message, and you need to hear it right now. 4. Sudden confusion. You're walking down a familiar street, one you've lived on for decades, and suddenly, you don't remember where you are. Or you see a loved one standing right in front of you, but their name slips away entirely. This isn't the ordinary forgetfulness that comes with age. This is a sudden, unexplained change, and it can be the loudest alarm your brain will ever sound. Our ability to recognize our surroundings, remember details, and process information depends on brain regions like the cortex and hippocampus. When the oxygen supply to these areas is cut off by a blood clot, or when pressure from a burst blood vessel compresses them, cognitive function can be disrupted instantly. You may lose your sense of direction, forget recent events, or fail to grasp what's happening around you. Unlike the slow decline of memory over time, this confusion arrives like a lightning strike, and it's just as dangerous. You can test yourself or someone else with simple questions like, "What day is it?" or "Where are we right now?" If the answers are wrong or muddled, especially alongside facial drooping, arm weakness, or slurred speech, treat it as a medical emergency. Picture this. It's a quiet afternoon, and James, 72, is walking home from the park. He's only a few blocks away, but suddenly he stops, unsure which way to turn. He tells himself it's just old age and keeps going. Hours later, he's in the hospital with a stroke, left with permanent memory loss and impaired processing abilities. The danger is that many dismiss this sign, believing it's a normal part of aging. In reality, habits like letting stress build until your blood vessels are under constant strain, carrying excess weight that fuels inflammation and vascular pressure, or even something as simple as not drinking enough water, thickening the blood all quietly, make the brain more vulnerable to a stroke. The good news is you can take control. Keep your mind calm through meditation, deep breathing, or yoga. Maintain a healthy weight through balanced eating and regular movement. Drink enough water each day to keep your circulation smooth. But above all, if sudden confusion appears even for just a few minutes, treat it as a serious warning. Call emergency services immediately. Don't let your mind disappear in a single moment, and never fully return. Every second you hesitate is another piece of memory, another part of yourself that could be gone forever. 5. Trouble seeing. You are reading a book, watching television, or looking out the window in the morning, and in a single moment, the image before you changes. Everything becomes blurred, as if seen through a layer of fog, or it doubles and makes you unsteady. Worse still, one side of your vision disappears completely, as if a curtain has been pulled down. This is not the time to think, "Maybe my eyes are tired," or "Perhaps I just need new glasses." This could be one of the most dangerous warning signs of a stroke. Our vision does not depend solely on our eyes, but also on complex neural pathways and the visual cortex located at the back of the brain. When a blood clot blocks the flow of blood to the retina or this area, or when a blood vessel bursts and exerts pressure on it, the brain can instantly lose its ability to process images normally. One eye, or half of your field of vision, can vanish without any pain at all. But do not let that silence fool you. It is a powerful alarm from within. You can check right now. Close one eye and look straight ahead, then switch sides. If you notice a dark area, a missing portion of the image, or blurriness, especially if it comes with dizziness, facial drooping, or arm weakness, treat this as an emergency. Imagine Helen, 66 years old, reading her morning paper. Suddenly, she realizes that half of the page has disappeared from her view. She assumes it must be an eye problem and schedules an eye exam for the following week. But only hours later, she suffers a major stroke, leaving her with permanent visual damage. If she had recognized it as a signal from her brain rather than just her eyes, the story could have ended differently. The danger is that many people confuse sudden vision changes with ordinary eye conditions, especially when there is no pain. Meanwhile, factors like uncontrolled diabetes damaging the retinal blood vessels, smoking harming the entire vascular system, or a sedentary lifestyle slowing circulation all increase the risk of vision loss from stroke. The good news is that you can lower this risk. Keep blood sugar stable through a healthy diet and medication as prescribed. Quit smoking to protect your blood vessels, and stay physically active to improve circulation. But above all, if your vision changes suddenly even for just a few minutes, treat it as a medical emergency. Call emergency services immediately and note the exact time it began. Because sometimes, the moment the world before you turns blurry is the very moment that will decide whether you will see it clearly for the rest of your life. 6. Dizziness or loss of balance. You are standing in the middle of a room, or simply stepping out into the garden, when suddenly the ground beneath you seems to tilt. Your body staggers, the room spins, and you have to grab onto something to keep from falling. You think, maybe it is because I did not sleep well, or perhaps I am just a bit dehydrated. But if it happens suddenly and with intensity, to be cautious. This could be your brain's way of warning you that a stroke is on the way. Your ability to stay balanced does not depend only on your legs or inner ears, but also on vital areas of the brain such as the cerebellum and brainstem. When a blood clot blocks the flow of blood that nourishes these regions, or when a blood vessel bursts and puts pressure on them, the signals that control stability are interrupted instantly. The result is that you may lose the ability to walk straight, stand steadily, or even turn your head without feeling as if the entire world is spinning. You can test yourself right now. Stand upright, close your eyes, and hold your position. If your body sways significantly, or if you find it difficult to keep your balance while walking, especially when accompanied by sudden severe dizziness, treat it as an emergency, particularly if it comes with other warning signs such as slurred speech, facial drooping, or arm weakness. Picture Robert, 69 years old, tending to his rose garden in the morning. As he bends down to trim a stem, he suddenly feels the world spin, his steps unsteady. Thinking it is just dehydration, he goes inside to rest. But only hours later, he suffers a stroke, leaving him with permanent balance problems. If he had called for help immediately, the outcome could have been very different. The danger is that this symptom is easy to dismiss because many people confuse it with inner ear issues or ordinary fatigue. Meanwhile, a diet too high in salt raises blood pressure, excessive alcohol damages blood vessels, and a sedentary lifestyle weakens muscles and makes the balance system less responsive, all of which quietly push you closer to a stroke. The good news is that you can protect yourself. Reduce salt in your meals, keep alcohol within healthy limits, or eliminate it entirely, and maintain regular balance-focused exercises such as yoga or Tai Chi. Most importantly, if sudden dizziness or loss of balance strikes, especially alongside any other sign of stroke, call emergency services immediately. Because sometimes, just one moment when the world tilts is enough to change the way you walk for the rest of your life. 7. Severe headache. You are sitting and watching television, reading the newspaper, or talking with your family when suddenly a pain like a lightning strike explodes inside your head. It is not the dull ache of an ordinary headache, but an intensity so severe that you believe you have never felt anything like it before. In just a few seconds, the pain peaks, as if someone is tightening a vice around your skull from the inside. If this happens suddenly, especially with nausea, vomiting, neck stiffness, or dizziness, think immediately about the possibility of a stroke, specifically a hemorrhagic stroke. The cause often begins when a blood vessel in the brain ruptures. Blood floods into the brain tissue, creating pressure that pushes against the surrounding areas. For older adults, especially those who have lived for years with high blood pressure, the vessel walls have become weakened and fragile, greatly increasing the risk. In some cases, an aneurysm or arteriovenous malformation, abnormal structures in the blood vessels, may have been silently present for years, waiting for the moment to burst. When intracranial pressure rises rapidly, every second determines the difference between life and death. Unlike common headaches, this pain does not give you the luxury of waiting to see or resting until it passes. This is the moment when acting immediately can save your life. If the headache is accompanied by facial drooping, arm weakness, or speech difficulty, then it is almost certain that your brain is in crisis. Picture Margaret, 71 years old, watching her favorite movie in the evening. Out of nowhere, a violent pain strikes, forcing her to clutch her head and close her eyes tightly. She assumes it is only a migraine she has experienced before and decides to lie down. Just 1 hour later, she falls into a coma from a brain hemorrhage. If she had called emergency services right away, her chances of survival and recovery would have been far greater. The frightening truth is that many people underestimate sudden headaches, especially if they have a history of chronic pain. But neglecting high blood pressure, overusing blood-thinning medication without monitoring, or letting stress build day after day, all of these weaken vessel walls and increase the risk of rupture. The good news is that you can reduce this risk. Control blood pressure by measuring it regularly and following prescribed treatment. Consult your doctor about safe dosages for anticoagulants, and use relaxation techniques like meditation or deep breathing to lower stress. But most importantly, if a severe, sudden, and unusual headache strikes, treat it as a medical emergency. Call for help immediately, because in this situation, even 1 minute's delay can be too late. Because sometimes, The thunderclap in your head is not warning you about the weather. It is warning you about the storm raging through your brain, and you may only have one chance to escape it. By the time you have listened this far, I believe you now understand. A stroke is not something that happens suddenly and without reason. It often leaves signs, small but urgent signals, just waiting for you to notice. An uneven smile, a weakened arm, a stumbling sentence, or a headache like a lightning strike, each one could be a reminder that time is being measured in seconds. For those over 65, every timely action not only saves your own life but also protects the remaining years, so they can be lived fully with family, friends, and the simple joys that make life worth living. And sometimes, recognizing the signs early and calling for help right away can be the most priceless gift you ever give to the people who love you. Remember, health is not just about you. Every time you share this knowledge, you give someone else a better chance at life. If you learned something valuable today, leave a like, so I know you are here with me. Share this video with your friends and family, especially those who may be at higher risk, so they too can recognize and prevent a stroke. And if you want to keep receiving trustworthy, easy to understand, and relatable health information, subscribe to this channel so you will not miss any of our upcoming content.